Westminster Free Clinic and Community Care Center is a not-for-profit healthcare provider with locations in Thousand Oaks, Oxnard, and Santa Paula. It includes people of all faiths and ethnicities and is run by healthcare professionals, including doctors, nurses, dietitians, dentists, and over 80 local high school volunteers. Westminster Free Clinic could not support the community it serves without the help of its dedicated volunteers. From the non-medical volunteer to the students to the expert medical professionals, volunteerism is essential to the mission of Westminster Free Clinic, and the clinic needs help, especially from medical professionals willing to donate time and expertise.
I'm trained in family medicine, which lends itself very well to primary care that we do. The medicine's very basic. I think we could use a dermatologist to help out doing primary care. You could be an orthopedic surgeon. We've had thoracic surgeons. The fundamentals of medicine, where we rely a lot on history, less on lab tests and scans, using your stethoscope wisely. When you enter as a volunteer to the Westminster Clinic, you feel kind of a sense of community. There's great energy with the students. They're high school students that volunteer, that are interested in healthcare. The vibe is very good. The energy is very high, and people really enjoy kind of coming here to serve. We do a lot of teaching, which is probably one of my favorite parts of coming. The high school students actually are in that space. They're in the clinic exam room with us doing physical exams. They spend time learning about the patient, they interview them, and then they come present them to the doctors, almost like a resident, and it's really neat to see that. I think that's a unique thing that we get to do. We often have scribes with us now who are pre-med college students. It's great to get to know them, mentor them a little bit about their careers in healthcare. And the teaching that we do circulates around between the students and the patients.
I love the student involvement of it, that this one for me is so much more fun because of the student part of it and the ongoing effect that I think that's going to have, because I think the students are strongly influenced by their experience here. And I think that they're so much more likely to be involved in free clinics and other community programs in their communities in the future. So I love the ripple effect that I think it's going to have.
I like the way that there's a variety of different doctors, a variety of different disciplines that are involved in the clinic, looking at different aspects of what the patient's needs are. For example, the diabetic clinic, for example, chiropractic coverage, different therapies, all of those things that are included in healthcare, and you have that available here.
I find it very rewarding. There's a lot of things we can do at the clinic as a nurse. We can take blood pressures, we can do finger sticks, we can do medical triages, we can teach students and prepare them for when they come in to see the doctor. It's really nice because we can do all those things, and we also can enjoy visiting with other professionals like ourselves.
This is a very noble, very fulfilling experience for me and my children. Even though I live a little distance from here, I look forward to the days I come, and I feel very gratified and happy with everybody that works here.
I definitely feel, after working here for 25 years, that what keeps me coming back is the appreciation that you get from the patients. Watching the students grow has been amazing to see what they do. Many of them go into careers in healthcare, which is inspiring to me to see that I've taken some kind of little part in that journey for them. So two of my sons volunteered as teen interns with the program when they were in high school. They had a great experience. It was a really good exposure to what healthcare actually is. One of my sons is thinking about going into social work now, and my oldest son now is a first-year resident in anesthesiology at Brigham and Women's Hospital. So he decided to bite the biggest bullet and go to med school at UC San Diego, and now he's a resident. I really encourage doctors who are on the fence about whether or not to volunteer, just come, do a quick tour, 15 minutes of your time, and I guarantee you'll love it.